I would say I have kind of two main areas of expertise. One is helping people with chronic pain and chronic illness and insomnia. I have specialty certifications in both those specialty trainings that I got from the VA. But I think, mainly with chronic illness and chronic pain, I've found that people really lose their identity to those types of issues, and they really start to over-identify with what their body is doing or is not doing. And there's a lot of feelings of betrayal that their body betrayed them. And so I think that really being able to kind of pull them out of their body a little bit, help them kind of reconnect with who they are in their soul and in their spirit, and find ways to even compensate for what their body is not doing well, and how they can, use all those things to have a more meaningful life and good quality of life, even if their body is not doing exactly what they want it to do. And then, of course, there's a lot of social issues that come along with that. I mean, a lot of stigmas, especially if there's an invisible illness, and people can't see, why do you have to rest so much, or why can't you ever go to this thing? And so really, giving people permission to just love on their body and be kind of compassionate, but learn how to create some boundaries, and of course, just spiritually, again, really bolstering that kind of internal sense of themselves. And then with the insomnia work, insomnia is really, really fun to work with. So many people struggle with insomnia and they don't know it. Or there's other things going on, like they have sleep apnea and they don't know it. But I love doing that kind of work too, because if you don't get good quality sleep, it really starts to eke out into other areas of your life. I mean, it's so much overlaps with depression and anxiety, and then you start having, problems in the family and problems in marriage because you're cranky and you're irritable and you can't think clearly. So, those issues, I just really love working on those issues because, there's always some depression and anxiety most of the time that goes along with those, but I think it's just one of those things we take for granted of how our body is functioning, or how we're sleeping, and we don't really think about the impact it has on the rest of our lives. So those are kind of my two main areas.